Bismillahirrahmanirrahim. Assalamu alaikum. Dear colleagues, many times I have been asked by my colleagues, especially the young ones and the PGs, that which type of testing is better for hepatitis B, hepatitis C, and HIV, ELISA or the ICT. And every time I answered, this is the ELISA, which is better and superior for testing hepatitis B, hepatitis C in HIV status. And today I would like to answer the same question again, but with the help of a couple of slides. So those colleagues which are a bit confused or which are not clear, so they become clear and be able to use the ICT and the ELISA testing in a better way for the patient's care and for the patient's scenario. Bismillahirrahmanirrahim. ICT versus ELISA. Which one is better and why? So to answer the question in simple words, when comparing immunochromatographic tests, that is the ICT or strip methods, and enzyme-linked immunosorbent assays, that is the ELISA, for diagnosing infections like hepatitis B, hepatitis C, and HIV, ELISA generally offers superior diagnostic accuracy. So why I am saying like this? Let's see the sensitivity and specificity patterns of these two methods. ELISA tests typically demonstrates higher sensitivity and specificity compared to ICT methods. For HBs antigen detection, ELISA sensitivity is of 95.12% and specificity of 99.82%, whereas ICT sensitivity is 92% and specificity is of 97%. In HCV, the ELISA detects more cases of HCV than various ICT kits, which has sensitivities ranging from 25 to 80%, depending on the brand. So it's a huge difference, especially for HCV. And HIV, the ICT-based rapid test misses 22.5% of HIV positive cases that ELISA detected, with the ICT test showing a sensitivity of 77.5%. So both the sensitivity and specificity is better for ELISA as compared to ICT methods. So the practical consideration, the ICT advantages are it's a rapid result, ease of use, and no requirement for complex laboratory infrastructure. And these make ICT suitable for initial screenings, especially in resource-limited settings. The ELISA advantages are that it's a higher accuracy, makes ELISA preferable for confirmatory testing and in clinical settings where the precise diagnosis is crucial. So these are the two important points. So I'll conclude the answer that while ICT offers convenience and speed, ELISA provides greater diagnostic accuracy for HBV, HCV, and HIV infections. In settings where resources allow, ELISA should be preferred method, particularly for confirmatory setting. So I hope I've been clear in my answers with the help of these slides that when compare the sensitivity and specificity of ELISA and ICT, ELISA has an edge on the ICT, but yes, ELISA is a bit expensive as compared to ICT methods. But where you are working in a resource-limited setting, then you may embark on the ICT testing But remember, you may miss cases in this method of testing. While in ELISA, it's a bit cumbersome, needs laboratory setup, and expensive, but it is more confirmatory as compared to ICT method. So I hope with this explanation, you will be able to use the ICT and ELISA method of testing appropriately in your everyday clinical practice and picking up those cases which are really important to diagnose and not missing them. So I end here. Inshallah, see you in another vlog on some other topic. Till then, take care. Khuda Hafiz.